Over 32 years experience representing healthcare professionals. He's the founder of Chapman Law Group, a multi-state firm dedicated to health law and the representation of health professionals.
Confidential records, we'll talk a little bit about that when we talk about some ethics, but remember this, the confidentiality, if this gentleman's my doctor, the confidentiality is between me and him. He can't even tell my wife unless I give him permission to tell my wife. So when you walk in the room and my wife's in the room and you're going to tell me I have herpes, you should probably ask, do you want your wife here? Right? Because if you don't, and I say, oh my God, blah, 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 I'm going to get you in trouble because my wife was there and my wife's not me. And you'll say, but you brought her in there. Say, yeah, but I didn't know you were going to tell me that. So just be careful of what you're doing, of who's in there. And it's easy to just say, is it okay that your wife's in here? Is it okay? Or who are you? And introduce yourself. And it's okay. Because some people want to bring their family members into a consult. Sometimes you want the family members there because the patient maybe has some dementia or some memory problems or comprehension problems, and you need a loved one to listen. So you want to make sure that you do that. Remember too that you own your records. Patient doesn't own your records. We'll talk about that with records a little bit more. Record keeping. These are the things to be in your records. This is just a good set of records. Patient history, exam results, test results, drugs, consultations, hospitalizations. When we talk about pain management in a minute, the rules are very specific if you're going to give pain meds. I don't know if any of you run pain clinics or are involved in pain clinics. Even if you're giving up to 3 days as a primary care doctor, you want to make sure that your records are very, very clear as to what you're doing. Release of records. Big thing here is you have to release the records. You have to. HIPAA has a violation. If you don't release the records in 30 days, HIPAA can actually come down and fine you. They rarely do, but there is a case. About a year ago, they fined a primary care group $50,000 because they took them 11 months to release records. Now, you can't release the records conditioned on them paying their bill. You can charge them reasonable fee for processing the records. But be careful, if your records are electronic and it's a matter of pushing a button to send the file somewhere else, what's reasonable to charge them, right? If you got to call in the copy service to copy some records, that's a whole different story. You could charge them the bill of the copy service, to do that kind of thing. So you could do that. My advice is, it depends on how burdensome. Some practices just have a lot of records have to be copied for a lot of things. So you have to create a standardized process for doing that. Hospitals, they create that process. X-rays. X-rays can be given at the actual cost to you, right? Or the actual cost of copying them. So if you've got to send X-rays out to a company to copy the actual film, you can charge them the cost of copying the film. If you're just Xeroxing the film for some reason, you don't have to do that. You can charge them extra for the report or anything. Keep records for at least 5 years from the last contact. And the big thing here is when you leave practices, you have to publish. One time, publish once a week for 4 weeks, and send a copy to the board, and it's advised that you send a letter to your patients and say, I'm closing my practice, I'm retiring, whatever. Now there's another reason to do that, because you don't want to abandon your patients, right? You want your patients to be able to get to an appropriate doctor. So start this ahead of the time and it's kind of a yin and a yang, because you're saying, well, yeah, I want to retire in 6 months, but I want to make money up until the time I retire. If I tell all my patients at 2 months, they're all going to leave and I'm not going to do very well for 6 months. Just have to work that out. And make sure that you don't abandon your patients, particularly the ones that just don't come to you for primary every now and again when they have a cold or a flu or something like that, but ones that are seeing you regularly for hypertension and cardiovascular disease and those kinds of things.
What if you're in a group practice?
Pardon?
What if you're in a group practice? Do you still have to send those letters?
No, in a group practice you don't but I would still send a letter to my patient and tell them I'm leaving. You don't have to publish it because they're really patients of the group.
Yep.
They're not your specific patients. But you still want them to know. The worst thing is to come in, and this still happens, you come in to see your doctor, hey, is Dr. Joe in? No, Dr. Joe retired 3 months ago. I wish you'd have told me, oh, but you can see Harry or Mo or whoever. Well, I don't know if I like them. They look like Doogie Howser. You guys know Doogie Howser? So I don't know if I want them. I want the other guy, or whatever the case is. Because remember this, I have a right to choice of who touches my body and who treats my body and who does whatever. And some people will just do where you push them because there's nothing else for them to do. They don't know that they can push back and say, no, I don't want this or I don't want that. Written prescriptions. A lot of people get in trouble these days with written prescriptions, mostly for narcotics, but even on other cases. So here's the thing. Prescriptions are controlled. Some are controlled if they're controlled medications. Others the state controls. And so in a written prescription, you have to clearly write who it's for. And I mean clearly, if you're going to handwrite these things, make sure somebody can read your handwriting, print it or something, or have it typed. You have to write the medication. If you want as dispensed only, you have to make sure that's clearly identified, or as written only, make sure that that's clearly identified. You have to put down the dosage. And you have to put down if the dosage is, a complicated one, like you're giving out, I have really bad asthma, I get prednisone a fair amount of time, exactly. Take 4 this time, 4 this time, blah, 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 blah. Make sure people know, what that is, okay? And it has to be written. There has to be a written signature. Now, you could do electronic records, and we'll talk about that in the next slide. When you write your signature, do not get a stamp and stamp like 15 ahead of time because you're very busy practice, so you have to do this. Because here's what's going to happen. You're going to have a very industrious LPN or medical assistant that works for you, that every pad that you stamp 15, he or she will take 3 or 4. And they'll have a nice lucrative business on the side, and one day you'll wake up when the FBI visits you and they say, why are you prescribing so much Oxycontin? And you're like, I never prescribe it. That's not what the record shows. And then you say, oh, it must have been that medical assistant. She stole them. Well, then you're in trouble because you didn't keep your prescriptions that were already written in a locked box. It's hard to get out of that when that happens. And you're going to say, well, that never happens. I'm here to tell you that happens way more than you think it happens. So watch it. Just make sure you have a pad that's a controlled pad that you keep, and you sign it when you give the medication. Not before, not after, not anything. Oh, and don't sign them so when you go on vacation, people that are getting regular medication can come in and your nurse can give them the script. Don't do that. That's a violation. Don't do that, okay? Electronic records, electronic prescriptions are good. You can have electronic prescription. You have to follow these rules. They have the prescribing, all these. You have to have software cannot influence the prescriber or interfere with the choice of the pharmacy. How does that happen? Oh, ABC Pharmacy has the greatest electronic software system for electronic prescriptions. And guess who gets 90% of all of the orders? ABC Pharmacy, that pays the company that wrote the thing, that wrote the program for you to send them. And you direct them and you don't even know it. Can't do that. You can't do that. Patient has the choice. So you can fill a prescription and you can tell the patient, look, we have a pharmacy in the building, or you can go to any of the pharmacies around. There's nothing wrong with saying that, because for their convenience, they might want to get it on the way out. Lots of times in hospitals or bigger clinics, they'll have a pharmacy right there, and you can fill it on the way. But you can't tell them, I'll send it down to the pharmacy. You have to ask them, do you have a pharmacy? If not, do you want us to send it to the one in the building? Just make sure there's a choice when you do that. Transparency. You want to be transparent. This goes back to apologizing and other things. Just don't be secretive about what you're doing with the patient. Tell the patient, what's going on. What about this? What about that? Tell them about their disease. Tell them the things that they need to know. Don't be coy and hide things from them. This little thing here, doesn't really affect you unless you're getting sued. But when you send, you think you're going to get sued, so you send all the records to me. I do a workup and I send all the records to an outside company to do an analysis. That process is discoverable. So we don't do that. You send the records to me. We have nurses that are employed by me that work for us, as contractors. They review them, then it's work product. If I send it out to a third party, it can be disclosed. And besides that, this isn't up here, but peer review has been completely knocked down, and peer review doesn't really exist that much anymore. I'm not peer review. The confidentiality of peer review. A lot of those documents now still get out, particularly here in Florida. The federal government says unless you comply with the federal government's financial program for monitoring things, and the name escapes me right now, which requires you to send records to them every time you have an outcome. If you comply with that, it's protected because the federal law protects it. Other than that, they're not protected. So you just want to be careful.